Hey, so why can't you make it to my party again?
Sorry, I have to go to the hospital. It's time for another blood transfusion.
Blood transfusion? For what?
I have sickle cell disease, and in order to stay healthy, I have to receive a blood transfusion every so often.
So what is sickle cell disease?
Sickle cell disease is a genetic disease where red blood cells take on a C-shape or sickle. This causes afflicted cells to be more readily susceptible to destruction, and they often tend to die early. A side effect of this is anemia, or a lack of red blood cells to transport oxygen throughout the body. This is most prevalent in the African American community, but affects all races as well.
So how do you get sickle cell disease then?
Sickle cell disease is an autosomal recessive disease. That means it requires a mutation in both HBB or beta globin genes. This form of sickle cell disease is called HBSS. People who have only one mutated beta globin gene and one normal gene are called a carrier or have sickle cell trait. Sickle cell trait usually does not cause health problems unless exposed to certain conditions. Sickle cell disease is diagnosed with blood spot tests, which are typically done during routine newborn screening following a birth. Some babies can be diagnosed before birth, but regardless, early diagnosis is vital to maintain a child's health. As stated before, since the mutation required to cause sickle cell disease is recessive, parents who both have one recessive mutated gene have a quarter chance of having a child with sickle cell following each pregnancy. Sickle cell disease usually starts to present at around 5 months, and symptoms and complications can vary between patients.
How does sickle cell disease make you sick?
Sickling is the process when sickle hemoglobin changes shape when not carrying oxygen. These sickle hemoglobin then gather with other sickle hemoglobin, which causes red blood cells to change into a sickle shape. Repeated sickling can weaken blood cells, leading to deficient cell membranes and early cell death.
What are the symptoms?
The most common symptom is pain, which is usually caused by clogged blood vessels. It is usually described as knife stabbing or hammer pounding. Another common symptom is anemia, or a lack of healthy red blood cells to carry oxygen, and is often closely associated with sickle cell disease. Anemia often brings along a variety of side effects, including tiredness, dizziness and lightheadedness, or increased heart rate. Patients with sickle cell disease are often more susceptible to infections, such as pneumonia. Another common symptom is splenic sequestration or spleen crisis, in which sickle cells get trapped in the spleen, causing it to expand. This leads to weakness, pale lips, fast breathing, extreme thirst, pain, and a fast heartbeat. Another common symptom is hand-foot syndrome, or swelling in extremities, often paired with fever. Moreover, some patients may even experience vision loss or blindness when blood vessels in the eye become blocked. Finally, there are various other symptoms that many patients may experience.
Is there any way to treat sickle cell disease?
The only cure for sickle cell disease are bone marrow or experimental cell transplants. Bone marrow transplants take healthy bone marrow, or the cells within bones where blood cells are produced, and move them into someone who has defective bone marrow. However, this requires a close match and can often be risky. Common treatments / prevention for symptoms such as swelling or pain may include adequate intake of fluids, pain medication, and specific sickle cell disease medication. On the other hand, blood transfusions are required to treat anemia, infections, splenic sequestrations, and other symptoms. Moreover, vaccines and hygienic practices can prevent against infections. Finally, consistent doctor visits can help monitor and preserve a patient's health throughout their life.
Wow, so in conclusion, sickle cell disease is a genetic disease that afflicts the blood cells. Sickle cell disease is caused by defective hemoglobin genes, causing blood cells to change into a sickle shape and become more easily destroyed. Sickle cell disease is usually diagnosed at birth following a blood test and requires 2 mutated hemoglobin genes. People with one gene have sickle cell trait and usually do not have symptoms. There are a variety of symptoms, but most common are pain and anemia. Treatments include blood transfusions, various medicine, but the only cures are bone marrow and stem cell transplants.
American Sickle Cell Anemia Association. Let's talk about sickle cell. You have the questions, we have the answers.